This is today's case of the day, the last one for this week, the sixth week, and it's titled Hybrid Congenital Lung Anomalies. And I do these typically around 9:15 and try and finish them in about 45 minutes. And I choose the case sometime during the day once the day's work is done. But there are days like today when you sometimes feel so helpless because we have no control over the world, and then you have these terror attacks like in Pahalgam where innocent people are gunned down and you feel angry, but there is nothing we can do. We have no control over any of these events. And then sometimes I think it's good that we are doctors and radiologists, because at least every day we can go to work, make one good diagnosis, maybe one do a good biopsy or one good IR procedure, um, alleviate the pain and suffering of maybe one person or patient every day, and make the world a better place to live in for that one person or family. And if we can do that, and then I think that rubs rubs off on us, and helps us cope with the world. So anyway, let's get on to the case. Just the end of the day and end of the day thoughts. So this 25-year-old presented with fever. I saw this case in the morning. It had been sent for an opinion by Dr. Athavan from Sri Lanka. And you can see here that there are these cystic areas in the left upper lobe and lingula, and then another focal lucency in the left lower lobe. And so there are two separate pathologies. The first is these confluent cystic areas, which represent congenital pulmonary adenomatoid malformation, or CPAM. And then we have this area where you see a bronchocele in the center, and this is along the anteromedial basal segment, and this is actually bronchial atresia. Patient had a third finding, a cyst in the high paratracheal region. So this is a foregut duplication / bronchogenic cyst. Now this paper, that article that came out in September 24 in Radiographics, is now become my Bible article for congenital lung anomalies. It just has everything. It lists all of these findings here. And when it comes to CPAM, it gives us this five type classification. Type 0 is incompatible with life. Type 1 is the commonest, and that's the case we have, where we have a cyst greater than 3 centimeters. And there's also secondary infection with bronchopneumonia and an air fluid level. And that's how I think the patient became symptomatic. Here's another 9-year-old with a type 1 CPAM. Bronchial atresia is characterized by proximal bronchial interruption with distal lucency, and here you can see that in our patient, but this is more striking. Another patient with a right apical bronchocele and then dysplastic lung with increased lucency and overinflation distally. So these are hybrid lesions. Hybrid lesions are congenital lung anomalies that coexist, such as CPAM and sequestration, CPAM and bronchial atresia and sequestration, etc. Our patient has CPAM and bronchial atresia and a bronchogenic foregut cyst. And this case was sent to me 2 years ago in 2023 by Ritu. I assume it's Ritu Agarwal from Jaipur. Thank you. If that's you. And here is a cluster of cysts, all of them less than 2 centimeters. So that's a type 2 CPAM. And there's intralobar sequestration. So congenital lung anomalies are not difficult to recognize and diagnose, but and they're uncommon. So that Radiographics article for me is the one that the moment I've picked up something, I will just go through it to reconfirm the findings, as I've done for this case as well. And remember, hybrid lesions are not uncommon. So if we see one congenital lung anomaly, we should look for another one. And sometimes you may even see 3, like in our case. My WhatsApp channel, thank you so much for listening to this. And I'm sorry if I rambled a little bit at the beginning, but that's just what I was feeling. Take care. Bye. I'll see you next week.